Heart attack or panic attack? 5 life-saving differences. You feel a tight chest, racing heart, maybe you're sweating? Is it just anxiety, or something much more dangerous? Trust me, I know it can be scary. Even as a doctor, I've had moments where I questioned what was happening in my own body. That's why I want to empower you with knowledge. In this video, we're breaking down the critical differences between a panic attack and a heart attack, and when to call 911. You deserve to feel confident and informed about your health. Let's get started. Panic attack. What's really happening? Let's talk about panic attacks. They can feel terrifying, I know. Your heart starts racing, your chest tightens up, and you might even feel dizzy or lightheaded. It can feel like you're losing control, maybe even like you're going to die. But here's the thing, a panic attack is your body's natural fight or flight response kicking in, even when there's no real danger. It's like your body hits the panic button when it's not supposed to. This flood of adrenaline is what causes those intense physical symptoms. It's important to remember that while a panic attack is incredibly unpleasant, it's not actually harming your heart. Now I know what you're thinking. Easy for you to say, Doc. But seriously, understanding what's happening can be a huge step in managing those feelings. Remember, you are not alone, and there are ways to cope. Heart attack, a different kind of emergency. Now let's talk about heart attacks. Unlike panic attacks, a heart attack is a serious medical emergency. It happens when blood flow to a part of your heart gets blocked, usually by a blood clot, and unfortunately, every minute matters. Here's the thing, heart attack symptoms can be sneaky. You might feel pressure, tightness, or a squeezing pain in your chest. This pain can also spread to your arms, back, neck, or jaw. Some people describe it as an elephant sitting on their chest. But here's where it gets tricky. Not all heart attacks are created equal. You might also experience shortness of breath, cold sweats, nausea, or lightheadedness. Some people, especially women, might have more subtle symptoms like fatigue or discomfort in their upper back. The bottom line is, if you're ever unsure, call 911 immediately. Don't wait to see if it passes. Getting checked out quickly can be the difference between life and death. Okay, let's break down the key differences between a panic attack and a heart attack, so you can feel confident knowing when to seek help. First, onset. A panic attack usually hits you like a ton of bricks. It's sudden, intense, and peaks within minutes. A heart attack, on the other hand, often develops gradually. Next, triggers. Panic attacks are often brought on by stress, anxiety, or even specific phobias. They're like your body's alarm system going haywire. Heart attacks, however, are usually triggered by physical factors like coronary artery disease. Now for the big one, symptoms. While both can cause chest pain, a panic attack often involves rapid breathing, dizziness, tingling, and a feeling of detachment. Heart attack pain tends to be more like a crushing pressure that can spread to your arms, jaw, or back. You might also experience shortness of breath, nausea, or sweating. Finally, duration. Panic attacks usually subside within 20 to 30 minutes, while heart attack symptoms persist and can even worsen over time. Remember, this is a general guide, and everyone experiences symptoms differently. If you're ever in doubt, trust your gut and call for help. I know it can be tough to tell the difference between a panic attack and a heart attack, especially in the heat of the moment. But here's the thing, you don't have to be a doctor to make that call. When it comes to your health, it's always better to err on the side of caution. Don't let fear or embarrassment stop you from calling 911. It's much better to be safe than sorry. Remember, those paramedics would rather show up and tell you everything is fine than have you wait too long and risk your life. Here's a little secret. Doctors would rather see you for a false alarm than miss a real emergency. We're not judging you, we just want you to be safe. So please, if you're ever unsure, pick up the phone and call for help. It could save your life. Here's a real-life quick tip that can help you distinguish between a panic attack and a heart attack. Pay attention to how your symptoms respond to deep breathing. Often, with a panic attack, those deep, controlled breaths can actually help alleviate your symptoms. It's like hitting the reset button on your body's alarm system. On the other hand, heart attack symptoms tend to persist or even worsen, regardless of your breathing. If you notice that your chest pain, shortness of breath, or other symptoms aren't budging, even with deep breathing, that's a major red flag. And remember, if your symptoms are accompanied by nausea, vomiting, jaw pain, or pain radiating down your left arm, don't hesitate to call 911. These are classic signs of a heart attack, and time is of the essence. The bottom line is, you know your body best. Trust your instincts. If something feels off, don't wait to see if it passes. Seek medical attention immediately. Your health is worth it. Don't gamble with your life. If it feels off, get checked. Your health is your most valuable asset. Remember, knowledge is power. The more you understand about your body and the warning signs of a heart attack, the better equipped you'll be to take action and potentially save a life, maybe even your own. And if you found this helpful, subscribe for more fast, life-saving health tips right here on Quick Dose. We're in this together.